In response to the pandemic's disproportionate impact on American Indian and Alaska Native communities, IHS and their partners, including the CDC, developed a vaccine plan to respond to infection rates that were over 3.5 times higher than the majority population and a COVID-19 hospitalization rate that at times had been 4 times greater. This plan, which continues to evolve, is currently focused on reducing infection and death rates through a vaccine distribution and administration strategy that involves both national and local partners. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderay, Executive Speechwriter for AHA. In this conversation, Rochelle Archuleta, Director of Policy for AHA, speaks with Dr. Sara Jumping Eagle of the Indian Health Services Hospital in Pine Ridge, South Dakota, and Jonathan Merrell, also with the Indian Health Services, as they discuss their collaborative effort to combat COVID-19 in the American Indian and Alaska Native communities.
Today, I'm excited to be joined by Dr. Sara Jumping Eagle and Kaylee Fretland to discuss their vaccine distribution plan that has allowed the Indian Health Services Agency to directly distribute vaccines to tribes, federally run entities, and urban Indian organizations. Kaylee, can you kick us off by telling us about the main elements of the IHS vaccination distribution plan and how your partnership assisted with its deployment on the ground?
Absolutely. This is Kaylee Fretland. I'd be happy to walk through Indian Health Services, IHS COVID-19 vaccination, really our implementation and distribution process. So last fall in 2020, before we had COVID-19 vaccines that had received EUA approval, IHS had the opportunity to work with Operation Warp Speed as well as CDC to discuss various strategies, as well as look at some additional state information on vaccinations. And reflecting back on H1N1 vaccines, CDC really helped advocate for IHS to be considered its own jurisdiction for the purposes of COVID-19 vaccine. So IHS got to work on creating a COVID-19 pandemic plan, and that pandemic plan really utilized the CDC playbook as a guidance for development, looking at prioritization, distribution and allocation, vaccine administration, our data management needs, communication, and safety and monitoring. So our IHS COVID-19 pandemic plan, which is available publicly on our website, is really broken into those 6 areas. What else we did is we structured our teams into those 6 specific areas, really utilizing subject matter experts throughout Indian Health Service from the local level, as well as our regional levels, which we call areas. And then from a headquarters standpoint, we partnered with underneath the incident command structure to ensure that we had really good communication channels in developing our plan. We reached out and did tribal consultation, getting the valuable input of our tribal health programs, our tribal leaders, and tribal communities. We also reached out to our urban Indian organizations, ensuring that we had their voices and their concerns also heard as we developed our pandemic plan. The overall IHS COVID-19 vaccine pandemic plan, the role was really to get COVID-19 vaccine to all tribal communities, all urban Indian organizations who wanted to participate with IHS as a jurisdiction. The tribal health programs and the urban Indian organizations had the ability to either go with a state jurisdiction or IHS jurisdiction to receive COVID-19 vaccine. And then our federal facilities all went with or are under the IHS umbrella to receive vaccine from IHS. So right now to date, we have 352 facilities that have signed agreements to receive vaccines through IHS. That number varies week to week because sites can opt to go from state to IHS and vice versa. And so we often see some of those changes. We also have the ability to update our populations as we go along. So last fall, compared to state, and I'll put this in preference, compared to the states all have the census data to use for their kind of population denominator, how many vaccines each state needed. Well, IHS, we have our beneficiaries, which we really consider under what we would call a user population. But our communities are made up of more than just beneficiaries. We have healthcare personnel, we have essential workers, we may have non-American Indian, Alaska Native beneficiaries within our communities. It was really important that our tribes and our facilities had the ability to include those healthcare personnel, essential workers, and those non-beneficiaries in their numbers. And so we allow that to be able to be changed on a week-by-week basis as needs of the tribal communities fluctuate or change, or as they really identify additional populations that need vaccines. And so our denominator, our overall patient population that we're providing vaccines for, does tend to fluctuate. Right now, we're at 2.18 million folks that we anticipate needing enough vaccine for COVID-19 vaccine, along with 352 facilities covering 35 states and 11 geographical areas. IHS is actually broken up into 12 geographical areas. We are providing vaccines to 11. The one area we're not providing any vaccines to is the Alaska area, which are the tribal health programs in the state of Alaska. They all opted to go with the state of Alaska for their COVID-19 vaccines.
Thank you so much, Kaylee. Very interesting, and I know very educational for our listeners. Why don't we switch to Dr. Jumping Eagle, and perhaps you could share the South Dakota experience, and more specifically the Pine Ridge Reservation perspective on the framework that Kaylee just laid out. Who were your key partners, and who really made vaccine distribution happen in your hospital on the reservation, as well as your affiliated sites?
Great, thank you. Yes, we've worked closely here at Pine Ridge Indian Health Service with the Oglala Sioux tribe on the COVID vaccination plan and the distribution plan. Early on, the Oglala Sioux tribe was asked if they wanted the Pine Ridge Indian Health Service to be a part of their COVID vaccine distribution plan, and they did choose to have the vaccine go through our service unit, the Pine Ridge IHS, to distribute the vaccines to the Pine Ridge Reservation communities. We had been collaborating with the Oglala Sioux Tribe COVID Task Force, and this task force had been designated to assist the community in coming up with COVID-related protocols and policies related to COVID. And so I had the opportunity and honor to be a part of the Oglala Sioux Tribe COVID Task Force. We collaborated with the IHS and the task force to develop the COVID vaccination plan for the service unit and for the Oglala Sioux Tribe based on the CDC and the ACIP recommendations for the phased vaccination plan. As part of that collaboration, we worked with a lot of the Oglala Sioux Tribe's health programs, essential workers, the corrections officers, police, ambulance program, and the initial parts of the COVID vaccine plan. So this was really an opportunity for us all to work together and get the essential workers vaccinated right away. And I think this was an example of really several programs and the federal agencies and the community programs working together to do what's best for the community.
Great. Can you also explain how the state level planning by the state of South Dakota influenced your work?
We've worked as part of the Indian Health Service, we've worked closely with the state as well throughout the COVID pandemic. Early on, we collaborated with the state Department of Health and the Oglala Sioux Tribe's Public Health Authority in reviewing the COVID cases and doing contact tracing, and then collaborating on the data sharing part so that we could help to keep the pandemic, at least here on the Pine Ridge Reservation, to keep track of it and to really collaborate on the contact tracing. Regarding the COVID vaccination plan, I would have to say that the Indian Health Service and the Oglala Sioux Tribe were oftentimes ahead of what some of the other states were doing, and I think that was related to initially some of the supply issues that were happening on a more national level. We had the benefit here at Pine Ridge IHS of working with the IHS area and headquarters in having a fairly steady supply of the COVID vaccine. So that allowed us to really work with the Oglala Sioux Tribe leadership and the task force in developing our COVID vaccine plan and going through the initial phases in a pretty streamlined manner.
Thank you. That's very helpful. In terms of vaccine confidence, we've seen that be an issue in a variety of communities. How have you addressed that, and how have any issues around vaccine confidence affected how you set your criteria for the vaccines? Who would be prioritized?
Well, here at the Pine Ridge Reservation, the Oglala, Lakota Nation, we have experienced some COVID vaccine hesitancy. I would have to say it hasn't initially affected our prioritization of the COVID vaccine. Our initial, when we were working with the Oglala Sioux Tribe and the task force, the priorities were really placed on those who are at highest risk for severe illness related to the COVID-19 disease. So we, like many others across the nation, prioritized those who were elderly, although for our communities, we placed the age limits a little bit lower than what the CDC and ACIP recommendations were, because we do recognize that we have higher health disparities and higher mortality rates in our communities. So, for example, we were prioritizing those who were 60 and over at an earlier stage than other communities were. We're also regarding the COVID vaccine hesitancy, really what we're looking at right now is those who were working to get in for vaccines are really trying to answer their questions of why they may not be as confident in the vaccine as our younger ages, those who are 16 and up until 50 years of age. And so we have shifted how we're targeting the vaccine right now to build confidence and really to address the questions, some of the myths and facts that people are seeing in social media, or questions that people are bringing up. We're talking about those on the radio. We're putting out written PSAs, oral PSAs, also doing, for example, Facebook Live events in collaboration with the Oglala Sioux Tribe COVID Task Force and the leadership of the tribe. We're also working on, we have a weekly radio show with our COVID vaccine team to answer the myths and the facts around COVID-19 vaccine.
Excellent, thank you. Any special efforts to get out to target populations? I know you've mentioned special outreach to homeless individuals, homebound as well.
Yeah, we have specific efforts that we're doing outreach with the COVID vaccine for those who have, we know in our communities that we have a lot of people who have challenges with transportation and living in very rural, remote areas. And on top of that, we also have community members who don't have homes, or maybe they're moving around a lot. And so our public health nurses are specifically reaching out to the homeless shelters and also to corrections and the jails to offer. We're prioritizing the one-dose vaccine for those who have more difficulty getting a second dose vaccine. So those are some of the efforts. Also, we put out some PSAs, and we're encouraging those who are homebound to reach out and so that we can coordinate a home visit for the COVID vaccine. For those who have a medical issue and have difficulty leaving their homes, there are those specific efforts towards the homebound.
Great, it sounds like a very comprehensive effort to really meet people where they are. What about volunteers? What role have volunteers played, and what recruitment strategies have you used?
For volunteers, I mean, we had a bigger effort. You know, most of our work thus far in the COVID-19 vaccine efforts have included our key partners, which are the Oglala Sioux Tribe COVID Task Force, OST, Oglala Sioux Tribe Emergency Management, the leadership, the Pine Ridge Reservation Schools, Oglala Sioux Tribe Tribal Programs, Great Plains IHS, and the National IHS, and our local COVID vaccination team here at the Pine Ridge IHS. We've also have some upcoming COVID vaccination events that are a collaboration between IHS, Oglala Sioux Tribe, South Dakota National Guard, Pine Ridge Reservation Schools, and then the Oglala Sioux Tribe tribal programs. We're working together to do some larger vaccine community events and to have some, it's basically like a health fair type of an event where we can still have people be socially distanced, but we're going to have a music DJ and offer vaccines at the same time. So, just to make it a little bit more fun, but also that people will be able to get vaccinated at these events as well. We have had some local volunteers that we've recruited. This was through the Oglala Lakota College Nursing School, and also through another group called Missouri Breaks that we've worked with. And so we've had a few volunteers who've helped with our COVID vaccine efforts as well.
Thank you. Is there anything else you'd like to share with the podcast listeners? Any emerging trends or other insights that you've gained through this effort that you think others should be aware of with regard to accessing or improving access to care for American Indian and Alaska Native communities?
I think, some of the things that we've been learning as we've been going along is really looking at how our team worked well within IHS, but then also reached out to the, tribal programs and to the tribe and our local COVID task force to really brainstorm what are the challenges that our community members face in healthcare access. And, one of those is transportation. So that's always a challenge for our community members. And sometimes, the weather can play a big part of that here as well in the Northern Plains. And so we're always trying to think of how we can improve our outreach efforts and also improve the information sharing. We know that a lot of people do have social media and cell phones, but a lot of people in the communities may not have access to the internet or may not have a cell phone. So we've also worked with groups such as the Oglala Sioux Tribe's Social Nutrition Program, also known as Elderly Meals Program, where we'll put flyers with their meals to get the information out to our elders in the community. And also we've had the advantage of working closer with Lakota-speaking community members who've helped us to translate written and spoken PSAs into the Lakota language for those in our community who speak Lakota as their first language. So those are unique things that we've done in our community as well. And so I want to say also that I'm really proud of the team that I work with, how everyone stepped up to offer as many COVID vaccines as possible to our community, to community members and essential workers. We were able to go through the vaccine plan and the phases in a pretty streamlined manner. And our teams went to nursing homes, corrections, schools, dialysis centers, really to try to make it as easy as possible for people in our community to get the vaccine and to protect as many people as we can and as fast as we can, as we know that there's several areas of the nations that are getting hit by maybe a second or third wave of the COVID virus. So we're just working hard to be prepared and to help our community as best we can.
I think one of the true successes of Indian Health Services COVID-19 vaccine campaign is really down to the local level, that each local level had the ability to determine those priority populations and really understand what the needs were in the community to get those critical people who are at the highest risk in for vaccinations early, to be able to prioritize the traditional language speakers, even getting the tribal leaders in at oftentimes for the vaccinations, because that really set a tone and a precedence. It set a confidence in the COVID-19 vaccine throughout Indian country, throughout those communities, and really encouraged, I think, tribal communities to embrace COVID-19 vaccine. And so I think everything that was already shared is so true, and this is really true across IHS for all of our federal tribal health programs and urban Indian organizations. Many of these same things are happening everywhere, but I'd really give it that a lot of the success of COVID-19 vaccine has really stemmed from the local level and being able to prioritize who needed the vaccine, because they know their community better than anybody else. And they are the voice of confidence. They are the social influencers in the community. And so being really to get those folks that the traditional leaders and the respected elders in for vaccines early has really been a key piece of getting more of the community in for COVID-19 vaccines.
Dr. Sara Jumping Eagle of the Indian Health Services Hospital in Pine Ridge, South Dakota, and Kaylee Fretlin, a leader of the IHS COVID-19 Vaccine Task Force. We thank you both for your leadership on this important work.